Excessive fatigue. Physical fatigue is often normal, but extreme and unusually severe fatigue can be a sign of an impending stroke. This type of fatigue can result from changes in blood flow to the brain, usually caused by atherosclerosis, hardening of the arteries, or a blood clot. If you experience this kind of fatigue, it is important to seek medical evaluation immediately. A condition known as a transient ischemic attack, TIA, can present similar symptoms before a stroke occurs. TIA is a warning sign of a future stroke and should not be ignored. TIA symptoms are similar to those of a stroke, but typically last only a few minutes to several hours and resolve completely within 24 hours. Therefore, anyone experiencing these symptoms should seek medical help promptly. High blood pressure, hypertension, is a serious health issue that significantly increases the risk of stroke. Blood pressure measures the force of blood against the walls of the arteries. When this pressure is consistently high, it can damage the blood vessels, leading to narrowing, weakening, or even rupture over time. Such damage can greatly increase the risk of a stroke. For example, if a blood vessel in the brain ruptures due to high blood pressure, it can lead to hemorrhagic stroke, also known as a brain hemorrhage. If hypertension damages the arteries that supply blood to the brain, it can result in narrowing or blockage, which may lead to ischemic stroke. An ischemic stroke occurs when blood flow to the brain is insufficient, depriving brain cells of oxygen. Managing high blood pressure is crucial to prevent such events. Maintaining a healthy lifestyle and adhering to prescribed medications are essential to controlling blood pressure effectively. Severe headache. While not every headache is a sign of a stroke, a sudden and severe headache can be a warning. In ischemic strokes, this headache may result from a blockage in blood flow to the brain and is often described as a sudden, intense pain. In hemorrhagic strokes, where bleeding occurs in the brain, the severe headache results from increased pressure inside the skull due to the bleeding. This elevated brain pressure can cause intense pain. Witnesses of a stroke often report the affected person clutching their head in extreme pain and sometimes losing consciousness. This reaction is especially common in hemorrhagic strokes, where the headache is frequently described as the worst headache of a person's life. Additionally, a severe headache can indicate a ruptured brain aneurysm. Vision problems. Changes in vision are another common sign of a stroke. Blurred vision, double vision, or difficulty focusing can indicate a problem in the brain's circulatory system. These symptoms should not be ignored, and immediate medical evaluation is necessary. Vision loss can result from blockages in the arteries supplying blood to the eyes and is typically associated with ischemic stroke. Numbness or weakness in limbs. Sudden numbness or weakness on one side of the body is one of the most recognizable warning signs of an impending stroke. This can also occur during a transient ischemic attack and usually affects an arm, a leg, or one side of the face. Numbness and weakness can last from a few minutes to several hours, but they should never be ignored. Anyone experiencing these symptoms should seek medical help immediately. Speech problems. A person experiencing a stroke may suddenly have difficulty speaking. This can manifest as slurred speech, trouble pronouncing words correctly, or difficulty forming coherent sentences. These symptoms are early warning signs of a stroke, and in such cases, it is essential to seek medical help quickly. Rapid heartbeat. A rapid and irregular heartbeat, medically known as arrhythmia, can significantly increase the risk of stroke, especially in certain types of arrhythmias. An arrhythmia occurs when there is an issue with the heart's electrical system, causing the heart to beat too fast, too slow, or irregularly. In conditions like atrial fibrillation, the heart's upper chambers contract irregularly and inefficiently, leading to poor blood circulation. This pooling of blood can increase the risk of blood clots. If one of these clots breaks loose and travels to the brain, it can block a brain artery, leading to a stroke. If you experience symptoms like palpitations, dizziness, shortness of breath, fatigue, or chest pain, consulting a cardiologist is recommended. Loss of coordination. Loss of coordination is another warning sign of a stroke. If you notice that your hands or feet are not responding as they should, this could be due to a lack of oxygen to the brain. Disruptions in blood flow can prevent certain areas of the brain from receiving enough oxygen, leading to coordination problems. When such symptoms occur, prompt medical evaluation is crucial. Loss of consciousness. As a stroke approaches, inadequate blood supply to the brain can lead to sudden confusion or loss of consciousness. A person may have difficulty processing events, forget where they are, or even lose consciousness. In such cases, immediate medical intervention is critical. Difficulty walking. As a stroke nears, You may also experience difficulty walking or a sudden loss of balance. If you find yourself struggling to walk unexpectedly, this could indicate that the blood flow to the areas of the brain responsible for controlling body movements is impaired. When these symptoms appear, seeking medical attention immediately is vital. Difficulty swallowing. People experiencing a stroke often have difficulty swallowing. Symptoms may include a sensation of food getting stuck in the throat, coughing, or an inability to swallow food completely. This condition is caused by damage to the nerves that control the muscles in the throat. When these symptoms arise, prompt medical assistance is necessary. If you have trouble sleeping, I recommend this video to help you sleep like a baby. Thank you for watching.